Good morning, folks. This is Siegfried, nurse practitioner with the Loveland Medical Clinic, giving you an update on the coronavirus on March 25th. So, my last video got banned by YouTube because I recommended using intravenous vitamin C to treat the coronavirus. Well, guess what? Now we have proven that IV vitamin C actually works. The Chinese have been doing it. They're giving to severely ill patients 100 to 200 milligrams per kilogram IV vitamin C once a day for 7 to 10 days. And they're saving people that are in the intensive care, and there's, no mortality. And now the word's got out to the U.S., which I think New York State now has the largest amount of cases. And so there is a Dr. Andrew Weber who's with he's a Long Island-based pulmonologist with the Northwell Health system, and they are now using IV vitamin C. They are giving 1,500 milligrams of IV vitamin C every 6 hours to their sick patients. Now, I think personally that dose is pretty small, but I can see how they can get away with it. So when you give IV vitamin C, you spike the serum level, and you need that high level so that your white blood cells can take the vitamin C, and it basically converts it into hydrogen peroxide, and that's what kills bacteria if you get bacterial pneumonia or viruses or fungus. So it creates hydrogen peroxide, and that's what has the killing effect. And you actually need a fairly high amount of vitamin C to actually get that reaction. And since they are redosing every 6 hours, they can keep that dose pretty high. The Chinese just did it once a day, so they actually gave a higher dose. They gave 10,000 to 12,000 milligrams, basically. If you come to my clinic and you want to get dosed with vitamin C, I usually give 12.5 thousand milligrams IV as not as a push. I give it in a liter of fluids because everyone in Colorado is basically dehydrated. So, something else really quickly. Let's see. And the clinical trial for the effectiveness of intravenous vitamin C was conducted on February 14th at the Zhonghan Hospital in Wuhan. And let's see if there's anything else. So anyways, we know New York City is now using the IV vitamin C. By the way, the recommended daily allowance, the RDA for oral vitamin C is 90 milligrams. You cannot get an effective dose to fight something like the coronavirus at 90 milligrams a day. It is absolutely ridiculous. So my recommendation is if you're going to try using, if you're not really sick and need to go to the hospital, you can try and treat yourself. And liposomal vitamin C is the most absorbable form. And what my recommendation is you take 1,000 milligrams every hour, up to about 6 to 10 grams per day. Okay, I wouldn't take more than 1,000 milligrams in an hour's time because there's kind of a limit in your gut about how much vitamin C your body can actually absorb. So if you spread it out, you will actually get a higher dose overall. Okay, so if you live somewhere else in the country and you're listening to me, because I'm in Loveland, Colorado, I take care of my local area with the vitamin C infusions. I would start calling around and find out who is giving IV vitamin C infusions. Unfortunately, you can't just go to an IV bar and get this. For one thing, a lot of the IV bars are closing, rightfully so. And the other thing is you actually have to be evaluated by a medical provider prior to getting high dose IV vitamin C. And I'm a nurse practitioner, so I can do that in my clinic. But once again, like I'm saying, call around, find out who's giving it, and have it in your back pocket in the event you get sick. So this is Siegfried Emma, nurse practitioner.